So, Gideon, let's get started. Let's start with the opening question. What is Ramadan?
So thank you very much for inviting me to come and discuss about this topic, which is an important calendar of the year. Ramadan is one of the 5 pillars of Islam and is an important calendar for population who are Muslim and especially if they've got different types of medical conditions, they need to be supported. In this case, I will try to make sure we discuss about Ramadan and fasting and the patient who are diabetic and the way to support them before and during Ramadan, and whether the issues we need to discuss to raise awareness about fasting and Ramadan, I think is an important topic.
Okay, thank you, Gideon. For people who may not know, could you explain a little bit about what's involved in observing Ramadan? My understanding is it could be anywhere from 10 to 21 hours of fasting, and that nothing can be consumed during that time. Is my understanding correct?
That's correct in that sense. And if I just generalize, I would say that in terms of timings of having meals, there's time in the evening when those who observe Ramadan or those who are fasting, they break their fast. That is, it's called iftar. That is in the evening, and the early hours of the morning. The second part where they go and have another meal is called suhoor. So in a way, everything is reversed. Meals are taken in the evening and at night, and not during daytime.
Okay, thank you. Thank you. That's informative. So when we've given a top line about what's involved in fasting of Ramadan, and of course, we're going to be focusing on people living with diabetes, both type 1 and type 2. So can you give some description about what goes into the decision about who would be advised that it's okay to fast and who would be advised against doing the fast?
So when it comes to fasting and deciding to fast, there are 3 aspects. One is a personal choice, which we have to respect. Number 2, there's religious aspect of that, which we also have to respect. But as healthcare professionals, there's medical opinion in those patients who they might have medical problems, including diabetes. How do we support them? If they decide to fast, we have to support them. We have to respect that decision as a personal choice or a religious choice, but we have to try and support them. And in terms of diabetes patients, you can look at a diabetes patient who are Muslim, and if they decide to fast, we can try and advise them by looking at which group or which category this group of patients they are in terms of risk to develop complications during fasting, i.e., you can put as one group which is high risk. So these are type 1 diabetes, maybe who are poorly controlled. These are type 2 diabetes with recurrent admissions with complications. Maybe they've got their own dialysis. Then you get a middle group, which is a moderate group. It's a moderate risk group. These are type 2 diabetes who are well controlled, or type 1 diabetes well controlled. But you get the lowest risk, low risk. These are type 2 diabetes who are on diet, or type 2 diabetes taking oral medications such as metformin or even sulfonylureas such as glucoside, but they are well controlled. Or if you want to try and simplify this, you can try and put these groups using traffic light system. So I'll say the red one is the high risk group. These are complex type 1 diabetes with poor control, type 2 with poor control or with complications. Then you get the yellow one is a moderate group. Then the green one is the low risk group. The reason we are discussing this is about what type of complication which we know, and it can be worse during Ramadan, the risk of getting diabetes ketoacidosis is increased. The risk of getting hyper-osmolar hyperglycemic state, which is very high sugar levels in type 2 diabetes, is increased. The risk of getting hypoglycemia, these are low sugars, is increased. And also, as we discussed before, based on which part of the world you are, some of the part of the world, the weather is very hot and humid, and the fasting hours are prolonged up to 20 hours. So there's a risk of dehydration. And with that comes the risk of getting thromboembolic event, that is DVT or pulmonary embolism. So those are the risks which can be increased, or they will be higher during the month of Ramadan. And therefore, for our patient who decide to fast and they are known to have either type 1 or type 2 diabetes, if they decide to fast, we have to support them. So the way we do to support them, the general guideline is that these patients who are diabetic, if they decide to fast, they need to be seen by healthcare professional 1 to 2 months before the start of Ramadan to go through structured education, i.e. that they might need to monitor their sugar level more regularly. And now we're using technology. We've got technology to give to type 1 and type 2 diabetes taking insulin. We can give them either freestyle Libra, which is available, at least from this part of the world in global north. We've got this and we're able to provide to our patients. In low resource setting country, it will be different. But also, the other guideline is that these patients need to be seen by either a general practitioner or diabetes specialist 3 months prior to the start of Ramadan. With that is part of ongoing initial support. And during Ramadan, we're going to provide that ongoing support for these patients.
Thank you, Gideon. You've covered a tremendous amount there. If I was to take us a step back and just to go over some of the things that you've mentioned. So you mentioned that there's a traffic light system. I'm going to put up a resource on the screen which shows the different categories. But in the very high risk, as you recommended, perhaps these people may be advised not to observe the fast, would be poorly controlled type 1 diabetes, perhaps type 2 diabetes, where the individual has a high need for insulin, or they have a lot of comorbidities, such as chronic kidney disease, coronary heart disease, maybe severe diabetic foot, for example. You mentioned people who had very severe hypoglycemia linked with their poor control, or perhaps they've lost their hypoglycemia awareness, so they're not able to recognize that they're having low blood sugar. I believe you mentioned pregnancy. I don't know if you did, but I'm guessing pregnancy with uncontrolled diabetes would probably be in that high risk category. And then anyone with acute illness. Then you said on the other side in the middle might be people who have better control, who are more able or are more fit and healthy, maybe people who are not taking insulin or SUs, maybe had their disease for less time, etc. Okay, great. I see you nodding. It looks like we're on the right path. Then you mentioned about people coming in prior to Ramadan to have an assessment. Now you said in, let's say, Global North, that could be with a secondary care team or primary care team, depending on the who's in charge of their care or who's leading on their care. And then you said in the Global South, it might look different. Could you please reiterate in the Global South, what is the advice for people if they don't have routine access to diabetes specialists? What should people be doing?
So in low resource setting, in this case, what I'm talking about, it depends upon the different services. But I think the best advice would be, again, to say that if there's a chance of these individuals to be seen by a healthcare professional, to be given advice. We know that in low resource setting countries, the community health workers can raise awareness about Ramadan fasting and diabetes. So we can use our community healthcare workers as a part of trying to raise awareness that if you are diabetic and you decide to fast, you need support. to be seen earlier by healthcare professional, whether it's healthcare worker in primary care or secondary care, which is difficult. But we can use our primary care service, which is made up of different types of healthcare professionals, including clinical officers. There's healthcare workers in the communities, in the villages, or in rural resource setting.
Yes, and I think you mentioned before, in higher income countries such as the UK, there might be access to continuous glucose monitoring as a technology to help people. Perhaps in some cases, maybe people with type 2 diabetes or those in a lower resource setting, maybe self-measured blood glucose using test strips and meters could be an option just to monitor blood sugar. Because I have here from the IBFDAR that there are certain circumstances where an individual might need to break the fast. I have a couple written down here. Gideon, I don't know if you want to give us an overview of what those circumstances would be.
So if you look at the Holy Book itself in terms of advice, it says that those who are exempted from fasting are the children, the pregnant women, those who travel, the sick. So if you're unwell for one or another reason, you are allowed to break the fast. I work in East London, where is inner East London, and we've got a big Muslim population. And as healthcare professional, we are trying to support them. And we looked at our patients just before COVID. We did a study called RADA, that's Ramadan admission rate audit for patients who came during Ramadan. And we have got a good number. And we had few patients who came with heart attack. And if they came with a heart attack, they have to break the fast. So if you are sick, you can break the fast. If you are unwell for one or another reason, you can break the fast. So there's a group of people, of individuals who are exempt from fasting. The sick, the children, the pregnant women, and those who travel, to mention the few as a group of patients or individuals who can be exempted from fasting.
Okay, and in addition to that, I've got a summary by Diabetes and Primary Care, and they've suggested a few other criteria in addition to acute illness. They've said a blood glucose level below 3.9 millimole per liter. They said above 16 millimole per liter, and then symptoms of hypoglycemia. What do you think about those? Do you agree that those are the guidelines that people should follow?
So because one of the way of treating is if somebody comes with hypoglycemia, and even given from our own previous study which we've done here locally, once you get hypoglycemia, you need to treat the hypoglycemia, and therefore it's part of saying that you're unwell. You might need to be given oral glucose, anything which is sugary stuff, to try and bring the sugar levels up, and therefore automatically with that, if you're unwell, you have to break the fast.
Okay. And what about high?
And if you've got very high sugar levels, in this case, if it's just high sugar levels, for type 1, if they go higher and higher, there's a risk of getting DKA. But if for type 2, if you can have a sugar level of 16, but you are well. So it's just to say that with the medication they are taking, we need to adjust their dose. I'll give you an example. Okay, if we say that our patient is type 2 diabetes taking glucoside 80 milligrams twice a day, we need to adjust the dose in these patients. So we say that at the time when they're breaking their fast, which is iftar, the dose of glucose will not change. But the morning dose, when they're eating for the second time, you might reduce by 25 to 50% to avoid hypoglycemia. If they are taking metformin 3 times, we simplify it by making twice a day. And if they're on once a day glucoside, you get a slow release glucoside. You don't change the dose. You take the medication at the time when they break their fast. If they are taking once a day insulin, you don't change. So coming back to your question of saying that what if the sugar level is above 16? So we can always look at that and adjust the dose. The timing of taking the medication is changed. Instead of being in the day, it is in the evening and night time. and that's how we support them. And that's why there's a need of ongoing support. So these patients should have an open access to healthcare professionals that I'm fasting, these are my readings, what's the advice? We need to give them ongoing support before and during the time of Ramadan.
Exactly as you said, Gideon, you said it at the start. It's making sure, whatever the setting, that if you're planning to take part in Ramadan fasting, that you're in constant communication with your healthcare team, whichever that could be healthcare workers trained in diabetes, it could be the diabetologist, such as yourself, Gideon, but it's just making sure that the people are making steps to do it safely. Okay, that's great. Right. Moving on to advice for people who choose to fast. So we've gone over who might be recommended to fast and who maybe we shouldn't. We've talked a little bit about medication and seeing your team. We've talked about when someone might need to break the fast. Now people are partaking in the fast. What lifestyle advice? I've got a few written down, but I'd love for you to start. What lifestyle advice do you give to people living with diabetes who are fasting for Ramadan?
So that's a very good question in terms of for these patients. So if we assume that they are seen 1 to 3 months prior to the start of Ramadan, they see a healthcare professional, whether they're a general practitioner, we go and try and raise awareness that what will be the complications. It means that they might need to be checking their sugar levels more often, okay, because we know that there's risk of getting hypoglycemia, there's the risk of getting diabetic ketoacidosis, there's a risk of getting HHS, there's a risk of being dehydrated, and there's a risk of getting thromboembolic events. So it means that they have to be well hydrated. If they decide to be involved in exercise, it will be light exercise. So it will be more often checking their sugar levels if they are using self-monitoring of blood glucose. But now we're using technology. If we are giving them Freestyle Libra, it means they have to scan more. And with the beauty about Freestyle Libra, it has got there's a set where you do the setting. If the sugar level goes very high, there will be an alarm. If it goes very low, there will be an alarm. So with that, this patient, they should be provided with technology. Those who are using technology, they should take advantage of the technology. But as long as they're aware that there's increased risk of complication during Ramadan, i.e. hypoglycemia, DKA, HHS, dehydration, and the thromboembolic event, that they need to be aware about that, but there's always ongoing support for them to make sure that they continue fasting without any complications.
Thank you, Gideon. Just so we go over, thromboembolic event is a blood clot for those people who may not be medical in our audience. And also, we don't have any affiliation with Freestyle Libre. It's just an example that obviously Gideon uses at his center. So I've got some other suggestions for lifestyle advice. It could be minimizing foods that are very high in sugar. I'm aware that people may break with dates, but breaking with dates, obviously a very concentrated, high sugar source of energy. So perhaps not leading with that so many, like balancing it out. When eating carbohydrates, don't necessarily eat very refined flours. It could be eating more legumes, beans, lentils, that type of thing. Drinking plenty of water when you're able to break the fast. As Gideon mentioned, dehydration is one of the things to be aware of. Avoiding fried foods. I know they're delicious, and if someone hasn't eaten all day, they might be very tempted to eat those things. But I guess if living with diabetes, there may be some challenges with that. And then I've got one here: eating the morning meal as late as possible. What do you think about that one, Gideon?
With that, I think it will depend upon which part of the world you are in terms of timing and so on. Yes. I think that is different for me to comment, but I know that it will depend upon which part of the world you are and the timing of that part, because it differs from time zone to time zone.
Okay, that's good. So let me see if we've covered who would be advised that they should avoid the fast, who might be okay to go ahead with it, that it's personal choice, religious preference, or how someone chooses to practice their faith, and then also the opinion of the healthcare professional to be able to support the person who's looking to observe Ramadan. We've talked about the situations when people should break the fast, even if they've started, the things to look out for. We talked about some ways you can help to reduce some of the risks, such as making sure to drink plenty of water when you're able to drink it. And we've discussed some lifestyle things to think about, such as reducing the amount of sugar that you eat when you're breaking. And we've also discussed some of the things regarding medication that someone might need to be aware of, and that there might be some changes to the medication that they take during this time. Gideon, is there anything else that you think we should cover?
I think from today's discussion, I think it is a very important topic. And as a healthcare professional from where I work, I try to raise awareness. And today I've given a talk on diabetes and Ramadan and fasting. And beginning of the month, I did the talk as well. And we are planning to do this as a part of Grand Round to try and raise awareness amongst healthcare professionals that we are likely to have these patients and we need to support them. And that support should be ongoing. Going forward, I think at the healthcare profession, we might ask for arrangement and permission from community religious people to allow us to raise awareness in the future, earlier prior to Ramadan, to go and discuss this topic, and also ongoing support during Ramadan. So we discussed today in terms of why it's important to give structured education 1 to 2 months prior to the start of Ramadan, and also for patients who decide to fast to be seen 3 months by a healthcare professional. There was a previous study which was called CREED study, that is CREED, CREED study. It showed that the patient who had the hypoglycemia 3 months prior to Ramadan, they were at risk of getting hypoglycemia during Ramadan, and vice versa. But also there's another study which looked at the admission rate during Ramadan. This is called EPIDIA study, that's AEPIDIAR. This study, EPIDIA study, showed that the rate of hospitalization increased by 5-fold in type 2 diabetes, but also there was increased by 3-fold in type 1 diabetes presenting with DKA. So these are examples of different studies which have shown that there's risk of getting complications during fasting for those who are diabetic, i.e. either just high sugar levels, acute hyperglycemia or HHS, or presenting with diabetes ketoacidosis. But also we have also discussed about other patients presenting with low sugars, such as hypoglycemia, and there's also risk of dehydration and risk of having clots on the legs or in the lungs, the so-called pulmonary embolism or DVT. That's in summary of this 2 study supporting what we've been discussing today. Thank you very much.
Absolutely. Thank you for that. It's great work that you're doing, and more research or insights from people in this area will, of course, be useful. Thank you so much, Gideon, for your time.